Welcome back. Well, we have a doctor today with Hoag that you specialize in female pelvic medicine and reconstructive surgery. I'd like to welcome Varuna Raizada.
Correct.
All right. Nice to have you here today.
Nice to be here.
So basically, tell me about the practice that you specialize in, just a little overall view.
Sure. So it's a bunch of words, a very long-winded title out there. I basically treat women mostly, and of all ages. Most of my demographic, though, falls from 30 to 65. I do see women as they grow older. The conditions that I treat pertain to pelvic floor organs, which consist of your bladder, bowel, and your reproductive organs. As women mature and become wiser, there are some conditions that occur, sometimes because of birth-related injuries, etc., like leakage of urine or malfunctioning bowels or bladder, and that's typically what I take care of, women who have diseases or disorders of the bladder and bowel.
Okay. As far as the different kinds of disorders that you mentioned, and I'm reading a talking point here, and I want to make sure I get this right. Pelvic floor disorder?
Correct.
Is that correct, or
Correct.
was it misspelled? Okay.
No, it's absolutely right. So, I will track back and tell you what pelvic floor really is.
Okay.
So, pelvic floor is a trough of, of muscles that we all have, men, women, on which rest our organs like the bowel, bladder, and our reproductive organs. For women, our organs function well if the pelvic floor is functioning well. So they communicate with each other. When there is a malfunction of the pelvic floor, for instance, due to birth-related injuries, like I stated before, these organs don't work as well, leading to certain disorders. The three main groups of disorders pertain to the bladder, like leakage or not being able to empty your bladder, something like even men experience, or of the bowels, where women unfortunately may be leaking bowels or may be able to pass their bowels normally. And then diseases relating to the pelvic organs, where organs are supported and kept in place with the help of these organs, with the help of these muscles. If the muscles are not functioning well, these organs begin to descend downwards following gravity, and in some women it begins to protrude outside their body where they can see and touch and feel it, and it's very uncomfortable for them to walk around and be active. So these are the main conditions that are disrupted when the pelvic floor is not functioning well.
What are some of the symptoms? I mean, some you explained are quite obvious.
Yes.
What are others that may be experienced?
So some of them are very obvious. Like I said, you'll be leaking urine. Most of the women may leak a little bit of urine, after they've given birth to children. But when it becomes to a point where it's interfering with your quality of life, when you are not socializing, when you are not going out and about, you're not exercising, that's where something that is just a once or twice occurrence has proceeded on to become a disease and needs to be taken care of. Same thing with the bowels. When once in a while, if you have diarrhea, you may have some leakage. But if it comes to a point where even without diarrhea, when you have fully formed stools and yet you are leaking those stools, you're unable to go out, socialize, etc., it's now gone into the realm of a disease. Other conditions of the bladder would be frequent bladder infections. That's what would bring women to come and see me. Or pain with urination. There are women who go and use the restroom very frequently. Some of them may have pain with urination. Some of them just maybe just can't get anywhere or can't plan anything because they are just living from bathroom break to a bathroom break to a bathroom break. So those are some of the bladder conditions. When it comes to the bowels, similar things. Leaking or not being able to pass bowels, or having a constant urge to go, pain with bowel movements, bleeding with bowel movements. These are some of the other symptoms to watch out for. As far as descending of the organ is concerned, this is something that you are going to be able to actually see and feel. When you walk around, you feel like there is a ball in between your legs, a chafing sensation. Sometimes women may, hear from their elders, their aunts, etc. This is a normal part of living, but sometimes it can really cause damage to internal organs like your kidneys. So I would recommend not putting it off or not ignoring these symptoms.
Okay. As far as different kinds of treatments that are available, surgical and non-surgical?
Correct. So when a woman comes to me for discussing her treatment options, we always start with some non-surgical options. I would say around 60 to 70% of the women can be easily treated with some non-surgical options. I would say a good proportion of them find complete resolution with some behavioral modification. For instance, what are you consuming? How much of it are you consuming? There are certain exercises and some training programs where we can train the bowels and the bladder to once again come under, to restore its communication to the brain, etc., back to its normalcy. So there are exercise programs. When those don't work, there are medications that help out and these medications don't have a very high side effect profile. So we transition from non-medication treatment options to medication treatment options as the woman evolves in her pathology.
Okay. Now, as far as the surgical options, would that be to the point where you say some of the organs have distended? At that point, something needs to be done.
So surgery is the best surgery is the one that you avoid, is what I always say. And the best surgeon is the one who is always telling you about all non-surgical treatment and is not knife happy. Surgery is the last resort. For women who are incontinent, there are surgical options which actually tighten up the bladder and has a very high success rate, 90 to 95% success rate. Remarkable improvement in quality of life, and it's can be done under 45 minutes in an outpatient setting, and there is no age bar. Many of my patients are older and they come to me and they are hesitant, is there an age limit, etc., and most of the time there isn't. Yes, there are some exceptions where some major surgeries may not be a good idea, but there is no criteria as far as exclusion is concerned for elderly women. For bowels, there are treatment options where we can actually implant devices that restore the normal bowel habits, where you have more control so that you're not having accidents that are outside your control. There are also surgical treatments that can tighten up the sphincter, all done as an outpatient in an outpatient setting. As far as the descending of the organ is concerned, there are surgeries that can be done both through the belly as well as through the vagina that actually restore the support of those internal organs. The abdominal surgeries are done through small incisions. They can either be done laparoscopically, those are long instruments that go inside your body, or they are done robotically. And one common question I get asked about the robotic surgery is if the robot is doing surgery, and I often tell them that that's not the case. The robot is assisting me. It just gives me the dexterity that sometimes even that is above and beyond human dexterity. So those are the smorgasbord of surgeries that are offered.
All right. As we talked about some of the symptoms, if they get to a point that someone thinks they might have a problem beyond, once in a while, this is the time to give someone like yourself a call.
I would recommend, always start with your primary care doctor to let them know what you're experiencing. Many times your primary care doctor may be able to resolve the condition. They may also be looking at other medical problems that are not pertaining, that may be, the bladder may just be the silent victim of those problems. For instance, if you are taking diuretics or water pills, the bladder is not at fault. It's just that your medications have to be adjusted, or you're taking some heart medications, or you're taking some asthma medications which can disrupt the functioning of those organs. So it's always a good idea to start off with your primary care doctor, who's going to be able to make sure that these conditions are not applicable. And when and if they feel that simple measures have not been able to help you, they will usually refer you to me, refer somebody like these women to me. That said, you also have the option to directly, contact somebody with my specialty in this area who can help you with these conditions.
All right, very good. And it was a pleasure having you on.
Likewise.
Good advice, and you really explained it quite well, so thank you very much. And again, I want to thank our guests. Is this your direct number that's been given to me?
Correct,
here?
it is.
Okay, 949-360-0300 for Dr. Raizada. And if you feel that you may have a condition coming on, as she said, talk to your primary first, and then from there they can direct you to the appropriate person who does the specialty. But it sounds like you're quite well versed at this. So
Yes.
it's been a pleasure having you on.
Thank you.
All right, we'll be right back.
Thanks.